First breaking news, Governor Gina Raimondo has made it official. Her stay-at-home order will not be extended after it expires tomorrow. I'm Shannon Heggie.
And I'm Mike Montecalvo. The governor says Rhode Island has met the criteria. She's set to begin reopening.
Nevertheless, the Rhode Island Department of Health is reporting another 18 people have died, 14 of whom lived in long-term care facilities. The number of people in the hospital did go down again, though, to 318, with 82 in intensive care and 56 on ventilators.
And the health department did report 325 new cases today, an increase from yesterday. While the governor says she would like that number to be lower, she says it's still more of a result of increased testing in vulnerable communities.
And she's also reiterating that phase 1 will not be much different than the way things are right now. Eyewitness News reporter Kim Kalunian joins us live from the State House with all the details. Kim?
Well, Shannon and Mike, we finally have the official word, and it's the one that we were expecting, that phase 1 of the state's reopening plan can begin on Saturday. The governor says the goal here is to get people back to work. She says the current economic situation is untenable.
Everyone keeps saying to me, Gov, are we going to lift the stay-at-home order on Saturday? The answer is yes.
After nearly 6 weeks, Rhode Island's stay-at-home order will end.
My goal is to get as many people back to work as quickly as possible without ever jeopardizing our public health and without ever having to go backwards to where we've just come from, which is shutting down our economy.
On Thursday, Governor Gina Raimondo announcing the state has met her 6 key metrics for reopening, including a reduction in the average number of daily cases and hospitalizations, expanded testing, and a sufficient number of available ICU beds.
And so I feel that we have the systems in place to move forward with phase 1.
Phase 1 will allow non-critical retailers to reopen with limited capacity, and some state parks will again be open to cars. Hospitals can resume required but non-emergency medical procedures. Churches can begin to have services with 5 people or less, and funerals can be attended by up to 10 people. But social distancing guidelines and the requirement to wear a mask in public will remain in place.
What's it going to look like? Frankly, not very different than it looks right now.
Restaurants will still be limited to takeout, but can now offer mixed drinks to go in addition to wine and beer. Those traveling into Rhode Island for reasons other than work, medical purposes, or to get food or gas must continue to self-quarantine for 14 days. And the governor will continue to limit social gatherings to 5 people and keep entertainment and close contact businesses closed until late May.
We're going to start slow. We're going to gain speed. And over the next few weeks and months, we're going to get right back to where we wanted to be.
And the governor says she doesn't know exactly how long phase 1 will last, but she estimates it will take at least 14 days to move into phase 2. Meanwhile, tomorrow, we are expecting to get more guidance from state leaders about how they plan to enforce the new mandate to wear a cloth face covering when you're out in public. A reminder that does go into effect tomorrow. Live at the State House, I'm Kim Kalunian, Eyewitness News. State leaders say they are working diligently to protect those communities living in nursing homes, assisted living centers, and other congregate care places where 70% of COVID-19 related fatalities here in Rhode Island have occurred. Today we got a little bit more context from the director of the Department of Health.
The numbers change day by day, but around 70% of our fatalities have been associated with long-term care facilities. A lot of people have asked us questions because they've compared that figure to the percentage in other states of fatalities that have been associated with long-term care facilities. I want to add one bit of context so that we can look at the full picture as well. Rhode Island's overall fatality rate for COVID-19 associated deaths is actually a little lower than the rates in some of our neighboring states like New York, Massachusetts, and Connecticut. People who live in congregate care settings in all these states and in Rhode Island are at an elevated risk for negative outcomes, as we've discussed. But the fact that Rhode Island has a lower overall fatality rate than some of our neighboring states can make it such that the proportion of our fatalities that are in congregate settings seem a little bit higher, relatively speaking. We have a lower number overall and more people in nursing homes of an older age, and so that can contribute to why that 70% of fatalities associated with long-term care facilities is occurring in Rhode Island.
And just a reminder that tomorrow is the final day of the stay-at-home order here in Rhode Island, but it is the first day that you will be required to wear a cloth face covering when out in public. We are expecting to learn more from state leaders tomorrow about how they plan to enforce that new rule. Live at the State House, I'm Kim Kalunian, Eyewitness News.